Hi there, my name is Carrie, and I'm going to be talking about my experience with my blood patches. I say blood patches plural, at Cedars-Sinai Hospital, more specifically with Dr. Shavink and his team at Cedars-Sinai. Um, and I'll kind of go through what their procedures are for a blood patch, what to expect, things that I didn't know that I think would have been helpful before going in that I wish I would have known, and just my perspective on the whole thing. If this is your first go around, if you have a CSF leak or a suspected CSF leak, um, go to the CSF Leak Foundation website first if you're in the US. Uh, and if you're in the UK, I think it's CSF League Association. Go there first and get information. They have tons of information, um, guidelines for things. Go there first because most likely you're going to go to your local hospital. You'll be treated. You'll have your patch, and you're going to be fine. And um, then after maybe your first blood patch or your second even, hopefully you would never have to do that, but then if that's failed, then you may want to consider going to an ultra specialist, which is what led me to Dr. Shavink at Cedars-Sinai. I live in the Los Angeles area, so that was the obvious choice for me. He sees patients from all over, but there are other great doctors in other locations. I know Stanford has a great program. Duke, I believe Dr. Gray is at Duke. So there are other hospitals that have great programs. Dr. Shavink is one of the best. So contact their office if you have had a failed blood patch, and even if you are unsure if they take your insurance, call and ask. They have a wonderful staff. They'll make an appointment with you. It may take a while depending on what time of year it is, how booked they are. They're very busy. Dr. Shavink does specialize in CSF leaks, but he does treat a lot of different conditions. So, but once you do get in to see Dr. Shavink, make sure you have everything written down. Your symptoms, definitely have them written down, because if you're not feeling well and you have a CSF leak, it's going to be very difficult to remember all the little details about your symptoms. And it's the little things that might be very important in making a clear diagnosis for you. So chances are he's going to have you do some additional imaging, probably even if you've already had an MRI, myelography, or whatever your local hospital has done. He'll probably want the images redone. So you'll have your images, and whether or not they find something, they'll be able to talk to you about that. You'll mostly be dealing with Dr. Schwink's nurse practitioner. Her name is Rachel Cruz, and she is fantastic. So that's the person that you're probably going to be dealing with. She answers all of the emails through the website, but Dr. Shavink does also read all of those messages. You're just going to be communicating directly with her during this whole process. Then once you get your date scheduled, right now the scheduler's name is Yuri. She is also fantastic. She's just a wonderful person. You'll get your date set for your blood patch. Now, just know that Dr. Shavink is not going to be performing your blood patch. He's a neurosurgeon. And a blood patch is not neurosurgical in itself. Usually the people who perform blood patches are either anesthesiologists or interventional radiology. I wasn't very clear on that when I started this whole process. An anesthesiologist did perform my first two blood patches, but it wasn't all very clear to me until I started I've had 5 blood patches. So I'm learning more and more as I have gone along, shall we say. But when you get to the date of your procedure, most likely they're going to tell you probably not to eat or drink anything past midnight. And the only thing I can say about that is you should go to I believe it's the American Association or the American Society of Anesthesiologists. Go to their website and look at their guidelines for eating and drinking before a procedure. I'm not here to give you any sort of medical advice, but look at their guidelines for eating and drinking before a procedure. It could be very helpful. I can say that it is so important to remain hydrated as much as you can. And I have had a lot of coconut water in the days before my procedures. Coconut water, I drink harmless coconut water. It's the only coconut water I actually enjoy drinking, and it's very hydrating. So, yes, American Society of Anesthesiologists, their guidelines, and also coconut water. So make sure you're well hydrated, because when you get into the pre-op room, the nurses are going to, depending on where you go, if you're at Cedars, there's a procedure, but maybe slightly different at other hospitals. They're going to give you 2 IVs. One IV for the sedation they're going to give you. Not all places will put you out for this, and I'll explain that more in a second. But so you'll need one IV for the sedation that they're going to give you, and then the second IV they're going to need to draw blood from you. So they're going to need 2. So just remember that. If you're not a big fan of needles, the more hydrated you are, the better it's going to be. So, like I said, I'm not telling you to do anything like, drink a gallon of water an hour before. Don't do that. But do pay attention to the guidelines. Once you have your IVs in, the team is going to come in and talk with you. You're going to have probably an anesthesiologist on your team who will come and talk to you while you're in the pre-op area, depending on what their schedule is. And then you'll have the IV radiologist will be performing your procedure. You're going to go into the theater, and most likely, if this is just a regular blood patch procedure, they're going to have you lie down on your stomach, prone, and you'll probably put your arms above your head, and they're going to transfer you onto a different table. Before that, when they're getting ready, they'll probably ask you if you have any questions. A good question to ask is, how much blood do you think are you anticipating that you're going to be using? Right? Because some doctors feel that more is better. Other doctors believe that they want to go easy on you, and whatever's tolerable is better. I'll get into more of that in a little bit, but that is one good question to ask beforehand, so you know what's going on. If you're doing this outpatient, you'll be able to see all this information in a report as a test result, but that is a good question to ask. Another question before you go under is, what sort of pain relief will I be offered in recovery? Because number one, you may or may not have a level of pain that's anything to report back, but you might, depending on how much blood they put in, where they put it in. And they tell you that, number one, you should not be taking opiates following the procedure because it could give you a rebound headache. Number two, you shouldn't be taking ibuprofen following the procedure because they want to make sure that your blood is clotting effectively. So these are things that I really wasn't aware of beforehand. those are good questions to ask of like what sort of pain relief will be offered to me afterwards. If I think of any other questions to ask before the procedure, I'll list it in the description, or I'll make an addendum. But I never had any questions beforehand, and I wish I would have asked those questions. So anyway, you'll be on your stomach, and then anesthesiologist will most likely they'll put you under light sedation, which for me I was out as far as I was concerned. And then the team of doctors will get everything positioned, and they have imaging to be able to do that. So they have image guiding the needles. Most likely you'll be having a double blood patch, so one in your thoracic region and one in your lumbar region. That's usually how they do it, depending. Every case is different. And so then they'll wake you up, right? And they will ask you, they're going to start injecting in the sites, and they're going to start asking you how you feel. What sort of things do you feel? Do you feel pressure in your head? Like, do you feel a whooshing sensation in your head? Do you feel pain in your lower back? Anything like that. And from my experience, once you say, they may give you like, what's your pain level? And, they will really listen to you. So don't be afraid. It may seem very intimidating to be asleep and then all of a sudden you're awake to having to say really important things. But, I've had 5 of these now, so they're very good with that, and they know what they're doing. And so they'll listen to you, and you'll have to talk to them. And then when they're done, you will still be on your stomach, and they'll lead you to the post-op or the PACU, where you'll be recovering. And you'll have to spend 2 hours on your stomach prone, and then they flip you over and you'll have to spend another 2 hours on your back before you can sit up. Now, what I recommend doing when you go into the PACU is you may want to pack, someone going with you, pack an eye mask. So it's not a very private area. There's all sorts of people that are recovering. You'll have your area where it's all curtained off and everything, but they may be able to give you earplugs, but you might bring some earplugs, an eye mask, possibly even something to watch a movie on, because you're going to be there for you're recovering for about 6 hours. This is an outpatient procedure, so just be aware of that. If you are coming from, out of town or even out of state, Dr. Shiffing sees people from all over the place. You may want to consider getting a hotel in the area. It's a very nice area. It's like West LA near Beverly Hills. So there are a lot of nice hotels in the area, but I'm sure you can find something that's, if you need something affordable, they have options there as well. So you don't have to travel very far. LA roads can be pretty bad. I drive a Fiat, so in LA, especially on La Cienega Boulevard, it gets pretty bumpy. So you may want to consider sleeping in a hotel for the first night. It may sound unappealing to you. You may just want to get home and be in your own bed, but just a thought. You may, in your time that you're recovering, experience a rebound headache. You may have a high pressure situation going on. You may or may not be, like I was talking about, be offered a variety of pain medication. I was originally, for my first blood patch at Cedars-Sinai, I was offered a variety of things, which ultimately made my headache worse, and I was nauseous and vomiting and things like that, and it was just not helpful. I ended up having to be admitted when I was in the hospital for 2 nights, actually, because I couldn't get my headache under control. The best thing to do, I believe, is to someone will come and see you after the procedure. Hopefully it will be nurse practitioner Rachel. And hopefully she will be able to kind of assess your situation, figure out if you're maybe having a rebound headache, if you're having a high pressure situation. She may be able to prescribe a diuretic, which is the go-to one is Diamox, or if you're not able to take Diamox, possibly Lasix. So it just depends on the situation. So just be aware of those things as you're going into it. Uh, Everybody is different, and each procedure is different. Every doctor who does these procedures is just different. So after that, you'll go home, and please be aware. I said go to the spinal fluid leak foundation. They have guidelines as to what your recovery should look like. Dr. Shiving's office also should have some guidelines of what you can and can't do after your procedure. Usually you'll have a 4 to 6 week restriction. And those restrictions include not lifting anything over 5 pounds. Now, 5 pounds that's nothing. So that includes, like, my coffee pot weighs, with coffee in it, is definitely more than 5 pounds. My MacBook Pro weighs 4.8 pounds. A gallon of milk weighs 8 pounds. Be prepared to not lift anything over 5 pounds for at least 4 weeks. If you have had 1 or 2 blood patches that have failed, you need to get on top of that right now. Because after my first blood patch at Cedars-Sinai, I was doing great. And after about the second week, I missed something. I don't know what I missed, but I may or may not have been this, but I walked on some soft sand. And 2 days later, I was right back at square one with my CSF leak. And it was devastating because by that time I had had a total of 3 blood patches, and it was bad. I was in a really bad place. So make sure that you're not walking on soft sand, you're not lifting anything over 5 pounds, you're not twisting or bending. Also, make sure that your digestive system is running well before you get into your procedure. And after your procedure, make sure that you're taking, they suggest you take Miralax. Take Miralax. You're going to probably be prescribed Colace. Do not take Senna products, anything that will make your abdominal muscles cramp. Sneezing, coughing, hiccups, those things, try to avoid them as much as you can. I know it's hard, but as much as you can, don't disrupt your abdominal muscles. It really does matter. So, you have 1 blood patch, most likely you're going to be fine. But if this is your second or third rodeo, you need to start thinking about what you can do to really heal yourself. And a really, really good, there's on the Spinal Fluid Leak Foundation website, there is a slideshow. I'm going to be putting that in the description. It's like a PowerPoint presentation by, I think she's a physical therapist. She has gone through spinal fluid leaks. And she has a really great comprehensive PowerPoint presentation on how the healing process works, how to do certain things. She demonstrates how to get out of bed, how to brush your teeth. I mean, there was stuff I was doing after my 3rd blood patch that I shouldn't have been doing and I didn't know. Like bending over the sink to brush my teeth. Don't do that. Like, just, you need to stay upright as much as you can. Anything more than just a slight bend, you're not going to want to do. Stay away from that, right? So now, the thing I want to say is, like I was saying, each doctor is different. My first blood patch at Cedars-Sinai, their total blood volume injected was a little over 30 milliliters. And this particular doctor who did my procedure believed that more was better. And I really had a tough time with it because I was really experiencing some a high pressure situation. And on top of that, I was prescribed Diamox and I became allergic to Diamox. my feet started, it felt like there was glass in my feet. It was really painful. So, uh, you know, it was not very comfortable. My second procedure was very conservative. I want to say it was Dr. Kaufman who performed my second procedure. And I was really freaked out in the recovery room when I had asked what the total volume was, and they said 9 milliliters. And I thought, 9 milliliters? Did I tell them the wrong things when they woke me up and they stopped too early and they didn't put enough blood in, and and the recovery nurses were so wonderful with me. They said, Carrie, that space where they're injecting the blood, there's not a whole lot of space there. 9 milliliters is still a good amount, and they know what they're doing. So they know what they're doing. So you didn't do anything wrong. Don't worry. Let's see how it goes. And that was for me, that was the most successful blood patch that I had. I would say after 2 weeks, I felt pretty good. I had very mild neck pain, and just know you may have some symptoms following your blood patch that may feel a little bit like your pre-patch symptoms. You may have some neck pain. You may have you may have spine pain. You most likely will have some sort of pain in your tailbone. So it'll be maybe uncomfortable for you to sit in a chair for extended periods of time. Just know that all of that is normal. If you do have any questions, you can definitely send a message to Dr. Shavink's office, and nurse practitioner Rachel will respond. But just know also, blood is very irritating. It's a very irritating, so you're gonna have some irritation back there. So all those things are normal. So I'm gonna finish this portion of my video up now, and I'll get into what's called a high volume blood patch in my next video, which is what ultimately they just did with me. But hopefully you'll go in for a consultation with Dr. Shavink or whoever else your next step is, and you're going to get good treatment and feel much better. All right, I hope this was helpful, and we'll talk to you again soon. Okay, bye-bye.